Hello, my name is Clare. I'm Chief Exec of the National Rheumatoid Arthritis Society, NRAS. I'm joined here today by Julie Begum, who is one of our nurse advisors and is the chair of the Rheumatology Forum of the RCN. You're very welcome, Julie. So we're here today to talk about the decision from NICE, the National Institute of Health and Care Excellence, about giving access to so-called moderate active RA patients to some of the advanced therapies. And so over to you, Julie. What do you think the impact of this decision is going to be on you and your fellow rheumatologists and rheumatology nurses?
Thank you, Claire. So again, we're so excited for the decision to be made to allow patients with moderate disease to be treated with the advanced therapies. And I think for us, the word that we're using is game changer. Because we know in our current work, when we're seeing patients that are coming through to the department who have been diagnosed with rheumatoid arthritis, there's a cohort of patients that really struggle with the way that we treat them at the moment. There's a cohort of patient that we see that we really want to be able to escalate treatment for and to be doing better for them. And I think this restriction that we've had with the way that we use medications has been difficult when you have a patient like that in front of you. And so we really welcome the decision and for us to be able to have options to share with our patients.
So up till now, you've probably heard that, compared to the rest of Western Europe, we've been behind the rest of Western Europe with access to it. So have you felt frustrated and a little bit, restrained in what you can offer these patients?
Of course. And I think, it is really disheartening to know that, the rest of Europe has had access and have been able to use these treatments for their patients with moderate disease, and that we're so far behind. We always pride ourselves that we're, the NHS and we're an excellent healthcare service. However, we haven't had the beauty of using what everybody else has. So that we do feel restricted, and I do feel frustrated that we haven't had it for such a long time. But I think, we're looking to the future. Patients in England should have all the options that everybody else has, and we're just so pleased that it's finally coming.
It's coming home, you could say.
Indeed.
But over your years of treating people with rheumatoid arthritis, what's the impact that you see of suboptimum treatment of RA, the long-term impact on individuals, not just their physical health, but their mental health?
Absolutely. And I think, I've been in rheumatology for 12 years now. And I think, we've really started to break that stereotype of what a rheumatoid arthritis patient is or looks like or can present as. And, we do see an awful lot of younger patients coming through our service. We see a lot of older people who really want quality of life. A patient I've recently seen, a young mother who is still working, has been diagnosed now with rheumatoid arthritis, really struggling, really waited an awful long time to come into the service. And when you see her, obviously she's still trying to understand what her condition is and what the swelling of swollen joints and the blood tests mean. But as clinicians, we know with her serology, which is seropositive, anti-CCP positive, that her journey is going to be difficult. And we're trying to do our best to try and use the treatments that we have. But she comes in frequently to see us. Obviously, we've got her on medication, we're escalating medication. You can see she's struggling to look after her child. She's gone on to part-time hours because she's struggling with work. And that's awful to see. I mean, the patient is probably a very similar age to me. And I just think, if myself as a mother, if I was struggling to the degree that she was, how hard that must be for her. So we're seeing cases like this again and again and again. I think we're just so pleased that we're able to offer more to these patients now that are coming through our doors.
So she wasn't quite reaching that criteria at this point. the previous criteria of that high
That's
DAS
right.
score, but
She's
now
still
perhaps could
absolutely.
be considered.
That's right, and she had really active disease with regards to there were swollen joints, and there was tenderness, and her inflammatory markers were there, but not just quite to the level that the current criteria allows us to escalate her treatment beyond what she's currently on. So there was a lot of sort of trying to tweak what she was currently on. We've had to use steroids in her care, which again, we're not always wanting to do because of the implications of that. And you can see she almost is losing a little bit of hope because she thinks this is what her life is going to be. And we try and keep her positive, and we're trying to sort of help her with disease management and self-management, and with brilliant organisations like NRAS that are there also supporting patients that we're seeing. It's just really hard because you can see that very glint in her eye that when she looks at you, she's almost thinking, this is it for me.
Mm.
And that's awful to see that back. And now, we're in an incredible position that potentially for patients that fall into this cohort, that we are going to be able to offer them something a little bit more.
And of course, it's not going to be, uh, open to everybody because there is still criteria, and it is not always appropriate for everybody that falls into this category to progress. But it's going to impact approximately 25,000 patients across England and Wales. So it's a substantial number that this could make a big difference to. Of course, we're recovering from pandemic. Rheumatology in particular was hard hit. So you've now got backlogs to deal with, and backlogs in seeing new patients as well as existing patients. And we have just seen the British Society for Rheumatology report on rheumatology workforce in crisis, which was before this pandemic hit. So I think we just have to be careful to measure or to reassure people that yes, we have these options, but it's not going to happen at speed.
Absolutely, and I think that's a really important point that you've highlighted, Claire, with regards to who is eligible. So, to reassure patients who may be listening to this recording that, the treatments that we have are brilliant, and they do work really, really well. There is this cohort of patient that we see that we potentially would like to escalate treatment slightly earlier than the current criteria allows us to. And that's who we're really looking for. But, my advice to patients would be, have a discussion with whoever you're seeing in your rheumatology team. And when they're doing the assessments to, look at your disease activity, your quality of life, and how your rheumatoid arthritis is impacting you, have that conversation as to whether there is anything else available and whether it's appropriate for your care, because all patients are very, very individual. And rightly so, Claire, you're mentioning their workforce. So it has been really, really difficult over the last 12 to 18 months trying to run services. We've had people redeployed. Our medics have been out there looking after all the COVID patients, which has obviously had an impact on rheumatology departments. We do have an awful lot of backlog, and we're working really hard to try and get things back to the norm, and get patients through the door and get people into clinics at an appropriate time. But we do need to be mindful that there are people that are not coming through to appointments on time, and we're really sorry for that, and we're really working hard to improve that. But if you feel that you are struggling, there is access to departments, and use your nurse advice lines and email contacts into your departments. We're not saying that we're not here and available for you if you are struggling with your disease. What we're saying is that it's slightly a little bit slower at the moment, and it may be that things do take a little bit longer to do. But we're trying really hard to sort that problem out and look into the future. And as you mentioned, that report, we are worried, and sitting as the RCN Rheumatology Forum chair, we are worried about recruitment into rheumatology nursing and into the consultant posts as well. It's not looking great across the UK, as that report suggests. And we need to think about how we deliver excellent services if we don't have the people in post to be able to deliver that. What do we do? And I think, there are lots of innovative ideas, and there's lots of thought about how we should approach this. But again, it's not a quick fix. It's not something that we're going to be able to fix overnight. And I think we need to, certainly as an RCN organisation looking after rheumatology nurses is our primary aim at the moment. And then we're going to start looking at, how do we keep our nurses? Everyone's really tired, and everyone wants to deliver excellent care, but we're just not in that position at the moment.
And I think that's an excellent point to finish on. That while this is brilliant news, we really welcome it. To just to pardon the pun, we need patience. That it's going to take a little while. But at least now we have that hope and that potential and those options that will not only improve the lives of those living with RA, but also improve the working lives of so many rheumatologists and rheumatology specialist nurses, because of course it makes you feel so much better to have that options to be able to do something and not have that restraint. Thank you so much, Julie, for joining me today to talk about this really important, game-changing opportunity in treating RA. Really appreciate you.
Lovely. Thank you so much, Claire.